Hi everybody, Dr. Anjana Bana here, and welcome back to my YouTube channel and our June series of Spill the Tea with Dr. B. So we're here at June's coffee bar gallery, so a whole lot of art, a whole lot of coffee, and in this video I am going to briefly touch on, I don't know if you can see what that is. Actually, it's a very bad painting. Let me try again. So it curves a little bit. There we go. There we go. A bit more. Okay, it's okay. So if you guys can tell what this is a butt. So you know, it's very in vogue now in the country, because recently the polylactic acid Sculpt, you know, it wasn't a launch or anything, but it was an event where they were talking about body treatments using polylactic acid, and the main focus, the Brazilian butt lift, and where Sculpt actually, or the polylactic actually comes from originally, is Brazil. And I know I spoke about this on a previous video, and we got you know, quite a few questions on that, and a few questions from patients. So just to like answer those questions, there's you know, you can use more than one biostimulate in the area. And when we went to our congress that I spoke about in an earlier video that just blew our mind at congress, that we had to think a lot about, there are other polylactic acid brands out there. There's so many that are moving into the space because this has become more and more popular, biostimulation, and not only for the face but also for the body. One of the questions that I got asked is, how many of these vials do you need? So it depends on the patient, but a good indication would be, you know, a good start would be 4 vials. That's quite a bit of product per patient, depending on their concern. So people sometimes want to lift, they want to sculpt, they want to also improve skin quality in terms of cellulite. It's still 4 vials, and in our country I think cost becomes a factor. So I would like to know in the comments, is this something you would do, or would people perhaps maybe, because here BBLs, like surgical BBLs, are still also very, very popular, but also one of the more dangerous surgeries you can do. Would people rather opt for that? But Vivian Gendaria, the plastic surgeon, says the friend of Sculptra, the friend of this polylactic acid, is time. So if you do your 4 vials, you don't have to immediately repeat in 4 to 6 weeks. You can, you know, in 3 months do your second set of 4 vials. But they said at least 3 treatments to create results. And I'm gonna, you know, we'll pop in some results in this video, in some inserts. And the other thing you can do for the area is CAHA, calcium hydroxyapatite. It's more immediate because it's an actual dermal filler. You'll also need 4 to 6 boxes to get a reasonable result. In the States, one of the nurse injectors, she called it Radias, which is quite funny, but he used 25 boxes of it to get a significant result. I personally wouldn't use that much in a single session, you know, thinking about safety as well as you know, there is also the cost factor, but mainly safety of the patient. So I would rather stretch it out over time, but also well documented. Besides for size, you can use it in a biostimulatory way to improve skin quality, texture. It also, from what we've seen, a bit of pigmentation, stretch marks, and cellulite. The other things you can do for this area that we do often, a little bit more often than those two, but we still do those two, would be radio frequency, using either microneedling or the non-ablative radio frequency, also for skin texture, tightening, and if needed, depending on what the patient wants in certain areas, centimeter loss, normal things like microneedling, normal things like peels, and even using a prescription retinoid in the area is something you can remember, because we were just talking about necks in the previous video, and you know, like taking the focus not away from the face. I don't think the focus will ever be away, but also thinking about other body areas. So if you have any questions, please drop them in the comments down below. Like, share, and subscribe. You can also rate my drawing. Usually I'm actually quite decent, but this is under a lot of pressure. Bye guys. Like, share and subscribe.